867. When a patient was first diagnosed with schizophrenia, one of his family members asked the nurse about the possible causes. The nurse said that one reason is that he may have had an excess secretion of a neurotransmitter. Which of the following neurotransmitters? A. Serotonin. B. Dopamine. C. Glutamate. D. Endorphins. The answer is B. Dopamine. 868. 11-month baby weight 8 kilograms has vomiting 7 times how many ml orally he can receive? A. 200. B. 600. C. 800. D. 1200. Weight x 75. The answer is B. 600. 869. Patient has low platelet, low hemoglobin, low WBCS. A. Prevent bleeding. B. Check vitals. C. Reverse isolation. The answer is C. Reverse isolation. 870. A child has diarrhea 7 times. He is irritable and lost his skin turgor. What is the degree of dehydration? A. Mild. B. Moderate. C. Severe. D. Extensive. The answer is B. Moderate. 871. According to information provider in the accompanying graphic, a transverse colostomy would be expected to produce which of the following? A. Fluid faces. B. A mushy feces. C. Semifluid feces. D. Solid feces. The answer B. Mushy feces. 872. Baby boy birth weight is 3 kilograms. What the expected at age of 1 year? A. 7. B. 9. C. 11. D. 13. The answer is B. 9. 873. Gastric suction can cause A. Metabolic acidosis. B. Respiratory acidosis. C. Metabolic alkalosis. D. Respiratory alkalosis. The answer is C. Metabolic alkalosis. 875. Oral iron supplements are prescribed for child with iron deficiency anemia. The nurse instruct the mother to administer the iron with which food? A. Orange juice. B. Apple juice. C. Milk. D. Water. The answer is A. Orange juice. 876. A 27-year-old woman patient's umbilical hernia is repaired under local anesthesia. Her gold amulet, which she kept under her pillow, was missing at first, but now is given to her after it is found from the bag of the housekeeping staff. The nurse in charge is to write an incident report which includes the patient's name, hospital identification number, date, time and place of incident, and the details of the item stolen. What short-term action is required by the in-charge nurse? A. Explain patient her belongings are her responsibility. B. Personal counseling of the housekeeping staff. C. Report incident to the security department. D. Dismiss the involved personnel. The answer is C. Report incident to the security department. 877. Patient is scheduled for a total hip arthroplasty. The nurse reviews the chart and notes the following: serum potassium 2.8 milliequivalent/L, AB positive blood type, and elevated ST segment electrocardiogram. Which of the following would be the most appropriate action to do next? A. Report abnormal diagnostic results to the surgeon. B. Review the patient consent for the surgical procedure. C. Educated the patient on the risk factors and side effects surgery. D. Ensure that the patient has a post-surgery physical therapy. The answer is A. Report abnormal diagnostic results to the surgeon. 878. Cardiac care unit nurse decide to gather relevant data of myocardia infarction patient who is breathing difficulty, bradycardia. What is the best kind of databases relevant to his situation for the nurse? A. Focused database. B. Complete database. C. Emergency database. D. Follow-up database. The answer is C, emergency database. 880, patient with osteoporosis, what is the best exercise he should practice? A. Walking. B. Bowling. The answer is A. Walking.